Hello, and welcome everyone to another episode of our exciting MAE speaker series, Industry Insights from Gator grads. We'd love to know where everyone's joining us from today. So if you wouldn't mind entering information on the YouTube chat, that would be exceptional. Today we're joined by MAE alumni, Dr. Amit Vohra. Amit earned his MBA at Duke University and his PhD in mechanical engineering in our department here at the University of Florida. Amit's currently the co-founder, CEO, and president of Promaxo. It's a medical technology company that develops and commercializes customer-centric MRI and robotic technologies that enhance patients' lives and really redefines the standard of care. Amit serves as the founding board member at 8 Chili and Nouveau, and as the West Coast Advisory Board member for the Herbert Wertheim College of Engineering. Prior to Promaxo, Amit was the CEO and president of Convergent Life Sciences, and previously as vice president of strategy and operations at Igen, he led the development and successful commercialization of two Class II medical devices in the urology market. We're delighted to have Amit here today to discuss his experiences and insights as an entrepreneur, CEO, and medical technology expert. With that, I'll hand it off to Amit to begin his presentation and discussion.
Thanks, Warren. I appreciate the kind words and everything. Again, I welcome this opportunity to talk and speak with each one of you. I'm going to try to be pretty casual about this presentation, try to make it more informal, and then see if you guys have any questions. Feel free to ask me anything about what you guys feel like, anything questions about the company itself and everything else. A topic I'm going to focus upon during this presentation is growing a startup. And when I say a startup is Promaxo during a crisis. I'll start with giving you an introduction of what we are doing, who we are, what products we're developing, what markets we're in, and then finally go into a specific incident that impacted us, which has impacted a lot of us, COVID-19, but how it impacted us and what we tried to do through it and how we're working through it. So I'll just start going live now and go through this presentation. Some of you guys might have seen what we do at Promaxo, but what we're doing is we're in Oakland on the West Coast. So I'm going to say good morning to everybody who's on the West Coast with me. We're developing, like Warren said, customer-centric MRI systems. When I say that, we're developing office-based MRs which are portable. So we're one of the first companies in the world that is developing a single-sided MRI configuration where a patient does not have to go inside a bore. And then while we do that, we also want to make MRIs more accessible and versatile. When I say that, we want to incorporate robotics through MRI. We want to incorporate conventional treatments such as ablation and even radiation treatment through MR. So we have our own robotic interface that works with our MR platform. And finally, just like everybody else in the space, we are leveraging a lot of artificial intelligence, both on imaging as well as in computer-aided diagnostics over a long time, over a long term, so we can get to tissue characterization and someday the holy grail of tumor classifications. So this is what our MR actually looks like. It's an actual snapshot of our MRI. We're much smaller, more compact. We are trying to bring imaging, robotics, and AI together into a physician's office. The patient and the bore, we keep getting asked this all the time, but bottom line is you really shouldn't put anything through it as an organ. That's not the idea. The patient lies next to the MRI and we have a robot that comes from the other side to guide an intervention under live MRI. But we're much smaller, compact, do not really require any infrastructure. So a lot of innovative things around it. And this kind of shows you one specific configuration of it. So the goal is that we want to just not make an impact on the provider side, but also provide a non-invasive protocol to patients. So the patients can come in, we can create a point of care analysis on doing MRs, we can create a point of care diagnostic platform, and then have something which can then be used even for biopsies and treatment. So this actually shows a snapshot of what an MRI looks like. Our core market, or should say beachhead market right now, is urology. So what we are doing there is looking at prostate and both benign and malignant conditions of it. The patient, as you can see, lies in a lithotomy position next to the MRI. We bring the robot from the other side, so we can do all the way from screening, diagnosis to treatment on a patient. We can bring radiation treatment into it. We are working and talking to companies. These are big names in the space that could do surgical robotics under MR. As you can think, any company like ours has to be innovative. So we're focused on primarily building new technologies and innovating. We have over 60 patents on our technology. We're aggressively bringing in more. We work very closely with MGH, Harvard, MIT, Stanford on the low field MR side. And we're bringing new technologies in, doing exclusive licensing on all those to complement what we have on intellectual property. Our scanner is pretty close to US market. We're working with FDA right now on a clearance pathway, and we should be cleared by end of this year. We're safe. We've passed all third-party testing on it. And our goal is to be in the US market, if not by end of this year, then Q1 of next year. So as you can imagine, these current scenarios have been kind of challenging, not just for us, but they are for everybody else. But we're still chugging along, and we still expect to be pretty close to our timelines. The company itself, we've been fortunate. We've been awarded and recognized by a bunch of people in the valley around the country. We got shortlisted across tech as one of the 12 most innovative companies. This was across verticals. Entrepreneur Media recently wrote about us as a disruptive imaging and robotic platform that could bring down healthcare costs and revolutionize healthcare. We've been writing articles about how we are trying to bring elements of these robotics and AI together to see how the impact would be on the physician themselves and the overall healthcare system. Super excited about having a team in the Valley that's at the forefront of innovation and working with the thought leaders in this space who could then do something which is so innovative. Every time you talk about MRIs, all of you guys would think of five companies, the GEs and the Philips and the Siemens of the world. To be in that space and being one of the innovators in that space is an interesting experience, to say the least. But we're fortunate. We've been supported a lot by NIH, NSF over the years, and we've raised a fair bit of money since then. That now we're getting close to making this innovation not just an academic proposition, but a real product now. As you can see, most of our team is R&D, imaging focused, robotics focused. We have 20 full-time employees. We have another 10 to 15 consultants. We have a couple of interns at office right now. We plan to bring in another two, but most of the team is highly technical. We have about 6 to 7 PhDs in the team, and about 60 to 70% of our team is just engineering focused and imaging focus on the scientific medical physics side. Most of them, I would say 95% of our team is in California. We have a couple of people outside of California. We have somebody in Arizona, and one, my co-founder, Michael, is in North Carolina. But we travel a fair bit. The company itself has a couple of locations. We're running everything out of Oakland in California, but we also have foreign jurisdiction in Maryland, because that's where we were officially founded about 4.5 years ago. So super excited to grow. I think by end of this year, we'll be closer to 25 to 30 employees. And we're on the growth chart to get and employ another 10 to 20 people over the next 12 to 18 months. So on the team side, you can look at the open positions on our careers page. We are aggressively hiring for 2 positions right now, an imaging scientist and a couple of engineering positions on the mechanical side as well as on the software side. Just like any other startup in the Valley, we offer competitive salaries and option packages. We have benefits which are equitable to pretty much not Facebook, but any of the other companies in the space. Pretty flexible work environment. We like to enjoy ourselves as much as work hard. And we do provide a bunch of amenities at work, which are similar to any other, like I said, startup that would provide in the Silicon Valley West Coast space. Uh, Again, I just wanted to give you guys a brief idea about who we are. We can always discuss more about it if you guys have questions about our technologies, about what we are doing, how we are doing this. I can go into that later. But what I wanted to focus this on was specifically how this whole unique scenario of unprecedented times that we are faced with, the COVID-19 crisis, and how we're trying to deal with it. So, and I'll give you where we were, what we were doing, and how we tried to manage this based on what we could do through it. So the company itself was raising Series B1 round, which is our commercialization round, and we were raising about 10 million, which started in December of last year. Now, just to give you an idea, I was in China when this COVID thing was just starting up, and we didn't think much of it at that point. Like I still traveled there. I came back, and we were hearing all this stuff happening in Wuhan, but we weren't impacted. I was in Shanghai, then I went to Taipei in Taiwan, and we really didn't think too much. Oh, this is going to come to US and impact us. Uh, Came back, and in January we had JP Morgan Healthcare Conference in San Francisco, which is one of the biggest conferences where people from around the world on the financial side show up. All the entrepreneurs are there. The big life sciences deals happened during that 1 week, and we had a lot of Asian people who came in. Now, still nobody in US was tracking that coronavirus is coming to US or is going to be that big a impact on our economy, and how it's going to impact each one of us. So we I still remember, like JPM gets over around the 14th 15th of January. I'm feeling super sick after that because I met a bunch of people. I personally was on the bed for 5 6 days, but just basically took it as, oh, I have flu, right? I recovered, kept coughing for about 15 days after that, and still there were no tests available. Nobody was really thinking about it, and there were a few of us who got sick within our company and within my family and everything, and we never really personally thought of it that it could even be COVID-19. So we go through it all, and then I'm still traveling. Like I'm in North Carolina in February, beginning of March. I'm in Boston sitting with MGH. We're trying to do trying to work together on a couple of different ways. Uh, and my last travel was March 6th. I came back, and then I'm here for a week, and then just things started happening. California was the first one, Northern Cal, to shut down everything. So all of a sudden, here we are trying to close a big financing round, and we're still trying to meet our timelines with FDA, where we have to submit, some clinical protocols to them. We had a meeting scheduled with FDA on April 13th, and this was already pre-planned, pre-COVID-19 days. So all of this is happening, and we just get this saying that, okay, the San Francisco County and Alameda County are going to put shelter at home in place. So now, first thing is, of course, you're worried about the health and well-being of everybody, right? You don't want to like do something which creates a scenario where you're trying to work while the health of the people and their families could get impacted. So that was our first goal, to see like how we could keep everyone safe, and can we still do something about our timelines. Can we still progress further and still meet our have our meeting with FDA and still try to submit everything, and see if we can close a financing round while all this is happening. So now it's a two-edged sword, uh, and both edges are kind of like not in your favor at this point, because you're trying to bring something into the company where investors are now sitting back and saying, oh, you know what, it's an escalating effect where, okay, we're going to sit back and see what happens as well. So we tried to do a couple of things. The first thing we did was, we knew that communication is ideal, right? And you need to be maybe over communicating rather than under communicating at this point. So we spoke to our lead investors who had committed to the round. We told them where we stood, what we're going to do. But then we also tried to see, how do we work through this. So first thing we did was, there was a thing that if you're an essential business, you could at least keep the doors open. So we spoke to Alameda County. We had conversations around here to see what could be done. So once we had a confirmation that we could run the business, then we had to get creative. So we tried to keep people away from each other. So we implemented two shifts. Uh, what we only needed to was majority of our people were working from home, but we had to get our MRI scanner running because that's the only way we can generate images, optimize our sequences. So what we tried to do was bring a couple of people in just to run the scanner and then also do it over 2 shifts. So not many people are getting close to each other. So as we were doing this, this needed a fair bit of buy-in from our entire team, and I'm so grateful to them that they were willing to work through this ordeal with us. Uh, and then rest of the team were working from home. So we have 20 people, like we had 16 to 15 to 16 people working from home in the beginning, and then we had about 4 to 5 people who would come in. Uh, and these people again would come in. We have about 8,000 square feet of space here. So we would just split them up. Like some people would be on the third floor, some would be on the fourth floor, uh, and try to make it work somehow. So that was one impact of it, and we kept chugging along. Also, on the other side, we came up with a revised plan for our investors, and we said, you know what, this is where we are. This is what we're doing. What do you guys think? Is the financing still going to come in at the time that we wanted? Now, we were planning to close everything by March. Now, things got delayed. We had a couple of people who backed out. But even then, on May 15th, we're proud to state that we were able to close our Series B1 round, or the first tranche of it. So that allowed us to bring money in at the time we wanted, maybe about a month behind, but still during the COVID-19 crisis, and still keep chugging along on a revised timeline where we could meet some of these dates and work through it. Now, we had a good meeting with FDA on April 13th. We conveyed and reached agreements on certain things on how the pathway is going to be for clearance. And then, again, that had to be a major change as well. This was supposed to be a face-to-face meeting. And then it ends up being a WebEx meeting where we had 17 people on WebEx from around the country. It was just unbelievable. And the most unbelievable thing about that meeting was, and I've never had that. Okay, this is kind of, in a way, we laughed about it at the end. Out of those 17 people, we had 16 people who had PhDs or MDs on the call, sitting around the country discussing what we're doing. And that's just like too much brain power on Zoom, trying to figure out what the pathway is, where it would have been much easier to sit together. Uh, but like I said, at the end, it turned out okay. We were able to come to some agreements. We're still working with them on doing what we need to do. So, in a way, it seems to work out. Now, over a period of time, things have started opening up in Northern California, which is good. The cases are somewhat stabilizing. So we had Alameda County open up, and now we have most of the people coming back in. We still have people working from home every now and then, but now we're almost getting back to full steam and running at full tilt. So I mean, the whole idea was that one thing we look at it was there were a lot of initiatives put in by the government, like the PPP program to help small business and help businesses get some capital in. But when you look at startups which are innovating, those seem to be the least favored at these kinds of situations because people are always looking at protecting the economy and protecting the jobs which exist today, not looking at doing innovation in times when there's a crisis. So how do you convince yourself and convince the masses and convince your investor community that you still need to do what needs to be done while the crisis is happening? That's the toughest thing. And there's two ways you can do it. One is keeping everybody engaged as much as you can, being adaptable, so you're only focusing on the tasks at hand and not doing all the rest of the stuff. And finally, getting a buy-in from your own team. Once you've done that, you can pivot fast. The good thing with startups is that you're lean, we're mean, so we can pivot pretty fast, which sometimes becomes harder with larger organizations where it's like a large ship that needs to be turned around. It takes forever. So all of those things kind of came together for us. Doesn't mean we did not have any impact from COVID-19, but overall we've been able to ride the wave. We feel comfortable where we are as a company. We have enough capital. We're bringing in more, and we're pretty much on course. Where we will be still commercializing, if not by end of this year, then Q1 of next year. So I just wanted to give you guys a feel of this. Again, there's a lot of small elements or like pieces of this puzzle which we can discuss in more detail. But overall, that's what we feel like was the biggest factor factor and impact that we could create during this by doing this, what we're doing. So again, I think that's my story right now. Uh, I can kind of stop here, or I can talk a bit more about this. But Warren, if you have any questions, we can talk about that as well.
Okay, thanks, Amit, for that wonderful presentation. So we're now going to answer some questions from the audience. So if you can just post your questions to the YouTube chat. We already have, it was such an engaging presentation. I had some questions, but we're already starting to get some questions in through the chat. We have our first question is from a bioengineering junior. And this person asked, what types of engineers work at Promaxo? How do BME majors fit in with MRI imaging and other devices?
Yeah, no, I mean, we have a good mix of not just like mechanical engineers, we have software engineers, we have imaging scientists, we have a few biomedical engineers. How they fit in is we build our own hardware as well. So we're building the MRI. We're not just working on the MRI. So we build the MR from the magnets themselves to the RF chain to the gradient coils, and then we're building our own robot. So actually, we're building three teams within Promaxo. One is focused, most of the team is currently focused on imaging, but we're building our robotics team, and then we're also building our artificial intelligence machine learning team. So we have some data analysts, data scientists as well. We're hiring later this year. So it's a good mix of not just engineers, but engineers and scientists. And we do like people who can do different things. They don't have to be just imaging scientists. If people are willing to wear multiple hats, uh, we can utilize them.
Okay. And Amit, what I found really engaging about your story is that obviously you have the engineering background and you have an MBA, but the being faced with starting a company and you talked about the engineering challenges involved. You talked about fundraising efforts with NSF and NIH, and I assume there's venture capitalist efforts that are involved as well. Sales, eventually workforce development. I know you're working on FDA clearance, which is a process in of itself. And then, it's taking a big risk in competing with the large scale companies that you mentioned, and showing resiliency through COVID. Just your story is amazing to me. Could you talk a little bit maybe about just your capacity for taking risk and ability to adapt and show resilience and faced with an event like COVID?
Yeah, I mean, I want to just give you an anecdote, which it just goes back on my, aptitude for taking risks, but more importantly, my family's, my wife's. I mean, she's a serial entrepreneur as well. Uh, I had left my last startup, in 2014, and I took a break. We had exited at that point, so it wasn't a bad thing. And then I said, you know what, we're gonna just do our MBAs. Both my wife and I wanted to do that. So, and we said, let's keep our networks independent. So we both got into the same schools, like the Dukes and the NYUs and everything. So I ended up going to Duke. So I was flying from California to North Carolina every 7, 8 days. And she did a global executive with UCLA and National University of Singapore. So she was flying all over Asia. But the idea was that, at that point, I was recruited by Medtronic, and Medtronic wanted to bring in somebody who was an entrepreneur. And the package was pretty nice. I wouldn't say it was bad, but thought about it, spent 6 months being courted by them, going back and forth, and then chanced upon this technology uh, while I was at a North Carolina biotech event. And I apologize for the trains behind here. So you know this was sounded too good to be true, right? Like when I looked at it, portable MRI, single sided, funded by NIH, NSF. This wasn't my idea, so I was recruited to be the CEO and just take it somewhere. uh, so we did our own fair bit of due diligence. So yeah, we're risk taking, we're everything, but what we did was my co-founder was introduced to me. He's a former Pfizer executive, Baxter guy. So he has commercialization experience, buy side transactions. So he was introduced to me through my wife Abita, and we spent about 15. Like I spent 15 months. He and I spent about 7 months before we started Promaxo, and we spoke to some big names. We spoke to John Rice at GE, and we said, "What do you think about it?" We spoke to DJ Sirota, who leads urology at Cook Medical. And we said, "What do you guys think about it? Do you guys want to do something?" So when we heard from John that, you know what, why don't I buy this? When he said that, we said, there's a business, let's start it. And we went directly to our customers first, who are urologists, our beachhead market, and said, "What do you guys think? Would you write checks to us?" And they started writing checks, and then we built a business around it. But going to the other side of the things, how risk, averse, or we moved to California. Like if I had $100,000, I would invest 50,000 in a startup. So it's a, and we do that all the time. Our family is invested in about 7, 8 startups right now. So of course we take a lot of risk. I don't mind not having a salary for 2 years. Even with this startup, it was 2.5 years before I saw any cash come into my hand. So yeah, I mean, it's fun to do, but the major thing is you make an impact, right? Once it gets used on a patient, that's the biggest gratification. So we're super excited with that close. So
So Jason Lee, who is a EEME dual major, asks, how resilient is the MRI imaging field in a crisis? My friends at Exactech lost their full-time internships during this pandemic, and they work on knee replacements.
yeah, that's a good question, right? So all elective procedures were kind of put on a back burner while this thing was happening. So now, how resilient is the imaging field itself? It depends. The field is going to come back, right? Because MRIs, now the electives are coming back, so procedures are coming back. But specific companies, and this kind of goes back to the question I see from Scott as well, Dr. Banks, which is this representative of everybody, or is it representative of you? I cannot explain why Exact Tech would do what they do, but I can tell you this: most of the startups boards, big companies boards, the first thing they said was preserve cash, right? So what preserve cash means in our language is let go of everybody you don't need right now. So you can extend cash as long as possible. So that's the concern with a lot of these things, the internships, full-time internships. If you don't need them and you can't use them, people tend to sit back and say, you know what, I'm not going to pursue this. So that's one of the reasons. It's not just as dependent on what's happening on the MRI field or the overall healthcare field. Healthcare is a pretty resilient market. Even during this crisis, the one field that was going up was life sciences and devices in some ways, because you know people know that actually it's opened up the eyes of a lot of investor community and standard community to you need to spend more on healthcare. So I do think it's not just that, but part of it is, of course, because elective procedures were not being performed, then yeah, a lot of companies are losing revenues in the short term, and nobody has cash reserves. So that impacts it.
So James King asks, can you speak to how to build engagement internally with your team and what you've learned over your years in the startup space that you would share as advice for young entrepreneurs?
Great question, James. So, again, basically, you need to talk to them. This is not an easy conversation to have with your team that, oh, guys, you need to work longer hours, you need to come in at odd hours. People have family, constraints, people have other constraints. It's just tough to do that. So, basically, one of the things you ensure in a startup from day one is having a culture where you have people who are aligned with you. This is not a 9 to 5 job at times. This can go up and down. There's a lot of crests and troughs in a startup. So people need to be resilient and they need to be adaptable to things that happen. At times we'll have our QA, manager do things which a QA manager wouldn't do in a large company. So you need to be able to do those. So even when we hire, we try to bring in people who are aligned with our vision. And the vision is, if we succeed, you guys are all going to be not just getting a paycheck. One thing is the extrinsic motivation, but the second thing we also look at is how do these guys want to make an impact like we do. At the end of the day, if they believe that they could create a healthcare impact and tell everybody that's the product I created, We feel proud about that we created a product that could be used on millions of patients and impact lives. And then, of course, the extrinsic motivation always plays a role. There are options in the company. As we keep doing well, we keep offering options. So it's not just a salary kind of a play. It's a play which also goes into, if we succeed, you succeed. So again, it's no easy way that all 100% buy-in, but we've been fortunate that we've built a team that really believes with us in what we're doing, and they're the ones who are executing. I can sit here and say whatever I want, but if the team is not executing, it doesn't help. So it's a new thing I just heard. Like, I was reading a book like called co-elevation, and so we've had different terms in business school, like leading from the bottom, or everybody is a leader. But what it also means is that everybody is accountable and everybody wants to do more than what their just job title is. And once you do that, you kind of create an ecosystem which is fun to work in. Doesn't mean it's not hard work. Trust me, like, people here work really long hours, but at the end of the day, it feels like a family.
So I think you touched on it a little bit there at the end, but Professor Bill Lear asked if you could talk a little bit about the difference between the company structure for a startup versus a traditional structure in an established company.
It's a good question, right? Like, what is a structure in a startup? Structure is what you want, right? Uh, you can have any structure in the beginning, and this keeps morphing. I think what they say is above a certain number of employees, it's very hard to keep getting your culture imparted to everybody. That's the big one. But overall, we try to keep it pretty casual. Like, yeah, people have titles and everything, but there is no real org chart that nobody can come and talk to me. We sit together. It's pretty fluidic structure. Other than the people sitting on the board who make a lot of decisions, we have an org chart because FDA requires an org chart. We have an org chart because investors like an org chart. But the org chart is as good as what you be. We want people to be coming in and talking to us. We don't want people to be ever feeling like, oh, they cannot come and talk to us about anything. We welcome, like, diversity of opinion. That's a big deal for us. Like, as you're doing these innovative things, you don't want to have a group think where you're just doing the same crap and going in a direction that doesn't make sense. And we would like people who are not an experts in the field specifically at times to come in and contribute as well, because sometimes you get the best ideas from people who are not that ingrained into that aspect of the research and technology. So going back to his question, there is a structure, but it's a pretty fluid structure. Are we in transition yet? Not yet. I think we'll be in transition once we get to a Series C round or something. Once we're above like 50 people or so, then there is a more structured environment that comes into play. We go into financial auditing, we go into all kinds of things post FDA as well. But as of now, we like what's happening. It's a fun place to be at. We like doing what we do.
So at UF, the provost has started a new AI initiative across the university, because different disciplines, you have some people who specialize in the development of AI tools, and then you have other communities of researchers that are using AI tools towards an end. And this initiative, this thought process, is to kind of coalesce all that expertise together. And I'm sure in Silicon Valley, you see a spectrum of that as well. And so Scott Banks asked, from a hiring perspective, then, in terms of machine learning, AI, do you look for people who are AI machine learning tool developers who are in that slice hardcore, or are you looking for users of machine learning? What's in terms of your hiring expectations there?
Yeah, so the answer is a pretty easy one. We're looking for both. I'm aware of the whole thing that's happening with machine learning and AI at UF. Sounds like a fun experience, right? Building an AI university at UF, that's going to be exciting to be part of that ecosystem for startups, for researchers, for everybody. What we want to do, because we're doing something very unique, We'll be the first and only company in the world that will have raw imaging data correlated to our own biopsy data. So we're collecting all this data today. So we just don't need somebody who's just an AI data analyst who can come in and just run the AI algorithms. We're developing our own algorithms, right? That's the tough part. Uh, and then once we have that done, so we need like algorithm scientists, we need algorithm engineers, and we need you know potentially guys with even PhDs who are going to come in and do some new research with us on building something that is applicable to us. But then of course we need people who can execute on it. At the end of the day, those are the people who can come in and come up with a solution that could be commercialized. So I would say as of now we already have like one scientist who we've hired. She is an expert in developing new algorithms for AI with imaging. And we have somebody who's a data analyst who's been dealing with implementing an AI algorithm for us. But we plan to keep building this team, uh, and bringing different skill sets into it, not just a specific skill set on AI or machine learning.
So
And then just going back to it, like there isn't a single company here that doesn't use AI, right? So it's kind of, we joke about it and we laugh about it. If you don't have AI in your company's thing, maybe you're doing something wrong. But we are building AI algorithms. We just don't want to be guys who are just using some AI algorithm built by somebody to do image processing or something.
So you've obviously established a career as an entrepreneur and have been very successful at doing that. So for our students who are entrepreneurial minded, what advice would you give them? Melissa, Dr. S asked, for our young entrepreneurs looking to get their first job, is there a right first job, or what would you recommend for someone to start their entrepreneurial track?
I mean, I think every entrepreneur is different, right? It's the mindset themselves. Like you need to get used to it, what an entrepreneurship means. But working in a startup helps because it tells you what it is. Like my first job was with a large company as a scientist, and you can see my son in the background now. But it was interesting because we were focused on certain research projects. I was fortunate though that I had a job where I could work across different customers and do customer driven projects for them. So it helped me, but I always wanted to be a startup. And my wife, being a serial entrepreneur as well, you need to have a buy-in from your family if you're married or you have a family. It's a tough thing, like to be a serial entrepreneur or an entrepreneur. It's not as easy as it sounds in the beginning. But if you have a buy-in, you know what you're getting into. Working in a startup helps. It does help you wear multiple hats, and it does allow you to see where you would fit in the best.
So James King offers a follow-up question to his first question. And he says that with the startup scene being so volatile, are there technical or interpersonal skills that you've acquired in your toolbox or learned over the years that have helped you remain agile and stay ahead of the trend and demonstrated value across your efforts?
Yeah, I think the biggest one I've learned is communicate as much as you can with your investor base, because like I was talking to our people yesterday as well, and I said if there is bad news, it doesn't get better with time. It's better to just convey it and then come up with a plan together with them. uh, on the technical skill side, I don't even know if I do anything technical nowadays. It just feels like I'm just raising capital all the time. But no, you need to have that mindset that everything on the technical side is towards creating a product, not a research projects. uh, Once you kind of have that mindset and you're always listening to the customer, it's no use creating a product that sounds sexy and great if your customers don't like it. So I think as much customer input as you can get upfront is critical, and you have to keep them engaged through the process. So if your customer is going to be a physician, you better have a product that makes sense to that physician. If your stakeholder is going to be a patient, it better help a patient. And then in our US mindset, you need to have the mindset that the payers are going to buy in, because people have to pay for this technology. It could be the best thing in the world, but if it's that disruptive that nobody is willing to pay for it, it makes it harder. Doesn't mean it won't happen, but it makes it harder to commercialize it. So Those are the big things that I have learned, that you need to consider all the stakeholders before you go in and start doing something. You need to know who your stakeholders are, and you need to have their input in as soon as possible. And then communicate with all of them as much as you can. The more information you can get, the better it is for you to create something that these guys will buy or pay, or invest in. So, and you keep learning. There is no one thing which works every time. So one thing we've learned is, when you commercialize a product, it never is ready. You can think as much as you want, you're ready. We've done this in the same field with 3 startups. But when you go in, you need to have 12 to 18 months of buy-in, and work on fixing things. So all of that has to be done, and has to be performed before you really commercialize and become a success.
So Samantha Miller, who's another ME alumni, who's now working at L3 Harris, asked the question, how easy is it to transition from working for a corporate company to taking the leap with an idea and transitioning it into a result? And how important is it to have a business partner that goes in with you?
Um, I think it's pretty easy to get out of a company, right? How easy it is to make it a success is, or do something with it, is a tough one. I don't really understand what it means to have a business partner. I'm hoping that it's somebody who's investing in there, or somebody who understands business. You do need to have advisors. If you're a first time entrepreneur, you need to bring in people who've done it a few times. Yeah, absolutely. An investor advisor. Advisors are critical. And these are people who could tell you how to navigate, whether raising money or building the right story for the investor base. One thing you always need to do is, when you prepare your pitch deck, you need to think of investors. These guys are writing checks to you. How are they going to make their money back? So always think of what the return on investment is going to be for them over a 5 year, 6 year period, and convey that to them right in the beginning. If you can do that, I think you have a pretty good business plan to work with. Uh, Translating from a corporate company to taking a leap, it just depends on the person. I was at Duke, and we talked about entrepreneurship. Like, we have guys here from Berkeley who've done MBAs here. It's just it's hard. Like, it's not that easy. Like, otherwise everybody would be an entrepreneur. It's a mindset that has to come in from within. You need to be willing to fail. You need to get to failure as soon as possible. Don't be scared of it. Like, I think that's the biggest advice I would give. If you're gonna fail, fail fast. Don't try to just sit back and just worry about those things. And usually it kind of works out.
So I had one other question that I wanted to ask in terms of the timeline and um, the looking forward, the horizon with the company. Um, I think you mentioned 2004 at one point, if I remember that correctly. So maybe could you talk about the life cycle and the time, the development time for going from idea to potential product development? And then I know with some startup companies, they only have money in the bank for months ahead, not years ahead. And maybe how that adjusts how they plan and what the timeline, how that impacts the timeline.
Yeah, I mean, first part of your question, you know, is like, what can you, how long does it take to bring a product? It depends on the product, right? If it's a software only app which needs engagement, then you're focused more on engagement, and that could take a year, it could take 4 years, but it could happen pretty fast. If it's a hardware product, or if you're doing something like what we are doing, an MRI, where you're building an MR from scratch with just changing the physics behind how MRIs are done, then it becomes a tougher problem. Like, I would say our technology has been in development since about 2009, 2010, uh, at Incubator first. So we were fortunate, we got buy-in from NIH and NSF, who paid us a fair bit of money, because it's very hard to go to somebody and say, I'm going to build a new MRI, and I don't have anything to show right now. I just have an idea. It's you pretty much put your own money in, or you hope you have wealthy friends who believe in you. But we had that buy-in from them. So once we got involved, there was already something to show. And we had like, okay, you know what? There's already $5 to $6 million of NIH funding into it. There is a very, very early prototype that does some stuff. We can get to good resolution, and now we go with it. So, but then we still had to come up with an idea how to make a story around it, who the beachhead market should be. Like people kept asking us, why won't you go into brain? Everybody MRI is our brain. Like, why are you going to urology? It's we knew the market well. We knew there is a need in the market, and we knew the stakeholders well. So you need to know your constituents, right? I mean, if you have that, then it makes it easier. But even then, for us, if you look at it, it's been 4.5 years. We're running much faster than a typical startup board. We've only burned through 14, 15 million of dilutive cash till now. So in a way, we're working more efficiently, like 50% less overhead and expenses than a typical capital equipment startup would. So all those things help. When you do that, it helps the investors, it helps you preserve your equity, and build value in the company. The second aspect of it is, of course, you know, how do you, like you were saying, yes, could you repeat the second part of your question? I kind of am like,
Yeah, maybe not in your company, but I know in some small companies,
oh yeah, for
or
money, how long it lasts. So usually you don't want to raise capital for more than 2 years ever, right? Like in any company, you always want to have inflection points come in, and then you bring in more money because you could build up the valuation ramps you want. So what we like to do is we like to keep capital for about 12 to 24 months, but we always bring in money once we're within 9 to 12 months of needing money. So the thing there is you should not be raising money when you're out of money, because you're not going to get a good deal, right? It's as simple as that. It's basic 101. You need to bring in money once there is enough money, because people like to follow. Everybody can say they're leaders, but it's the fear of missing out as an investor. So if you can create that fear of missing out among the investor base, you will bring in more money than you typically need at a certain point. But then you need to stop, because you cannot just bring in money at a certain valuation pre-money, because you're going to dilute yourself too much, and you're going to dilute your previous investors too much. So it's a game you play. As long as you're comfortable bringing in that money at the right time, I think it's good. But every entrepreneur is different. There is no real fixed thing that you need to have 2 years of runway or 3 months of runway. As long as you believe you can close the money when you need it, or before you need it, I think you're in good shape.
and so Dr. S asked a follow-on question there too, in terms of, did that motivate you moving from Maryland to California to be in more of a hot economic market?
See, that's not how Maryland looks at us. They gave us money to be there. So I always lived in California, and I was commuting between Maryland and California for 2 years. So after a while, one part of it is if you're a startup in California, you get higher valuations. It's a known fact. You get at least 20% higher valuation if you're here. And that's because the investor base is here, they understand it. But that doesn't mean there aren't other regions which are better. I mean, some of the regions really give you, like Maryland has a very good ecosystem of giving you money from the state itself. So we leverage some of that. Uh, but our reason for coming here was, of course, to procure better talent. Me, I'm sold on California. I personally don't like the tax structure here, but other than that, it's pretty nice to be here. The weather is nice, everything is nice. Now, Florida is cool. I mean, I like Florida. I just don't see a VC community in Florida. There needs to be more of it. Like, so you can grow a company up to a certain stage, and people have done well in Florida. I'm not going to say that you can create a company anywhere and you can be very successful. But certain hotbeds help because you have all the infrastructure around you, not just from investors, but the legal teams and your accounting teams and the talent that you need to bring in. All of that makes it easier to grow to a certain stage. So
And I guess maybe we'll take a final question here from Professor Banks. And he's asking, how did you hone your communication skills? And do you have some suggestions for current students to be more effective communicators?
I think I'm still honing my communication skills. I mean, that's the one which is tough one to answer, right? Like, I think it helps. Like, the more you present, one thing when I worked at UF as well with Yogi Goswami, uh, Yogi used to have us present almost every week during the group meetings or every other week, right? When the meetings happen. And it's not comfortable to go in and talk in front of people, but it's good to do that because you learn uh, and you try to get more and more accustomed to it. That's one thing. Second thing is also you try to say things which, as I said, if you prepare, you always want to prepare, right? As much as you can. To what your audience is going to be. So once you know your audience somewhat, like you prepare yourself for that audience, and then you learn and you adapt. You have to be willing to learn. If somebody comes to you and says, and I'll tell you one thing. This was 2009, my first startup. I was sitting with somebody in Sacramento, and they said, "Oh, I don't understand your accent." And there's two ways to look at it, right? Like with all the stuff happening around you, you can say, oh, this guy's, but I asked him, what do you, and I still speak pretty fast, I know that. uh, and some of you guys might feel that as well. But you tend to just listen. And I asked him, I didn't stop there, I said, what do you mean? Is it you don't understand certain words I'm saying? Am I speaking too fast? And I don't care. I didn't care a bit about the guy, right? That's not the point. I don't want him to like me. I'm more interested in if there is something that I could learn, it's fine. Um, I didn't get any useful input from him, so it was kind of a useless question to ask him specifically. But overall, it's okay if somebody says that to you. Uh, you try to incorporate whatever you can. It's hard to do that, right? Another thing in our leadership courses at Duke, they would just come in and say, and there are two ways to it. We would come in and make these speeches, and their big thing was, are you using any fillers? Now, there are two thought processes on that. People say you should use fillers because it makes you think, but then there's also say don't use fillers because it you keep using the same word every third word. So they try to make us be conscious about it, and have this thing about listening to yourself. They would record you and make you listen again and again, and see how you could improve. So there are various ways you can do that. I don't think I've done any concerted effort to do one thing or the other, except maybe a couple of things. The only thing I do is prepare. If I'm going to go present, even though I don't try to wing these things, I still try to do something about it. Uh, but after a while, you get used to it. So yeah.
So, Dr. Vohra, we really appreciate your time and your presentation and answering the questions. But at this time, our presentation and discussion comes to a close. Thanks everyone for attending and asking so many really insightful questions and staying engaged. We'll be launching another episode of our MAE speaker series next week, so please be on the lookout for that. And have a great day, everyone.
Thanks, Dr. Vic Dixon. And thank you, everyone. You can reach out to me if you want. You can get my details. Would love to hear from you guys later as well. Thanks. Bye bye.